Is Sermorelin the same as Tesamorelin? This is a question a lot of people ask. They said, well, shouldn't I just use the same growth hormone releasing peptide? Aren't they all kind of the same? Well, in this video, I'm going to show you how you can differentiate between all the different options when it comes to growth hormone releasing peptides. And maybe I'll even show you, like, why would I even need that, Regan? I mean, maybe I have enough growth hormone. Maybe you do, and this is not for you. But as we dive in, by the end of this video, my goal is to help you differentiate between Sermorelin, Tesamorelin, but also understand how you can look at these more objectively and figure out which one might be best for you. And encourage you to make sure you're using it from licensed pharmacies, a 503A, 503B licensed pharmacy, and have a prescribing physician who gets these peptides for you and works with you as a team. This is not medical advice, but if you are looking for support and help in your health optimization journey, you can easily go to agelessfuture.com and my team will take very good care of you. So let's jump into the science. So what is the difference between these two peptides? Well, first of all, what peptides are is these strings of amino acids, and they're pulled together by covalent bonds, and then they have these terminal end groups and acetylation that allow these peptides to have a very specific shape. And just like shapes in nature, like if you think of a building being square, if the walls are tilted a little bit, well, that's not good. Over time, gravity tends to pull things down. But if you have upright shapes, and if you have triangles, for example, you're going to have a lot stronger of a bond, and it's no different in peptides. So if you have peptides that aren't structured correctly, they're going to get degraded very quickly, and you're not going to have the same expression genetically as you would if you have peptides that are made the same way that your body releases these peptides. Because in your body, the way that your cells communicate is they're just sending out peptides. And these peptides bring different messengers to each of the cells. And then once that gene gets turned on, then you can start experiencing greater levels of health with very little downside if done properly. So the difference between Tesamorelin and Sermorelin simply is in the structure of the amino acids, the length of the amino acid bonds, and the mechanism of action. It's a little bit different. So Tesamorelin is 44 amino acid chains, and these amino acid chains, they activate growth hormone through the pituitary. Now, Sermorelin is 29 amino acid chains, and these are structured in a different way than Tesamorelin. So it's a line of amino acids, and then the bonding folds them in a very particular way. And I would do the little model of it, but you'll have to look at the chemistry on this. But for those of you who just really want to know the differentiation, you can even look at another peptide for growth hormone like hexarelin, or you can look at CJC1295, which is roughly 26 amino acid chains. And because of the change of the structure and the shape, you're going to get a little different response in your body. And so both Tesamorelin and Sermorelin have been FDA approved for certain medical conditions. Tesamorelin goes under the brand name Agrifta, and it does cost a fortune if you're using the pharmaceutical name, but we get all of ours through compounding pharmacies, and it's called Tesamorelin. Usually we'll stack it with a peptide called Ipamorelin, and I've got a great video on that where I dive into the whys, but Ipamorelin prevents you from getting that massive hunger surge that can come when growth hormone is activated. If you think of this, it's a growth hormone releasing peptide. It works on the GHRH pathway, and it's clinically been approved to get rid of visceral fat. So visceral fat is that abdominal fat, and this was first approved for HIV patients who had a lot of what's called lipodystrophy. It's best for patients who have lower IGF-1 levels, and it's also been shown to help improve fibrotic liver. So if your liver gets damaged, or if you have low IGF-1 levels or a growth hormone deficiency, Tesamorelin is amazing. And yes, approved for very specific FDA conditions, but what they found in the clinical trials is they found that people who used it versus the control group, they had better muscle mass, they had lowering of triglycerides and cholesterol, they also had better cognitive function, and most importantly, they lost that visceral fat, which decreased their hemoglobin A1C, so their blood sugars stabilized. Sermorelin, on the other hand, once again, this is 29 amino acid chains. It was primarily used for younger patients who had growth hormone deficiency. So, we've used it for kids who they just aren't thriving, and they have tall parents, and, maybe at the age of 13 or 14, they just stop growing. And so by using Sermorelin, we first look at the blood labs, and if they have a clinical diagnosis of growth hormone deficiency, then Sermorelin can actually be a really powerful treatment for them. There's another peptide that we use more frequently now because it's oral based, whereas Tesamorelin and Sermorelin are better through injections, subcutaneous injections. But that peptide's called Macimorelin. And it's not only is it a way of diagnosing, is it growth hormone deficiency because someone's IGF-1 levels are low, their growth hormone levels are low, and does it increase those levels? And then it also is the treatment. And so Sermorelin is something that you also want to cycle. So for those of you who are watching this video for growth optimization and health optimization, which is probably most of you, many of you are watching it for longevity. Some of you are just maybe bored out of your mind and just said, well, let's see what this dude has to say. So hopefully I'll give you a little insight. But the biggest thing that you want to think about is when you're working on growth hormone pathways and working with peptides, and especially for those of you who are clients of ours at East West, you'll find that there's a time where we use Tesamorelin and we cycle you off of it, and we may bring in Sermorelin the following month. So we may do 1 month or 2 months on Tesamorelin, and you're doing it 5 days out of the week. You're taking 2 days off. You want to inject it when you're in a fasted state. And why in a fasted state? Well, when insulin levels are too high, then you don't get the same pulsatility of growth hormone. And so you want to keep insulin levels nice and stable. You want to make sure you're working on blood sugar. So if your blood sugar is completely dysregulated, you're not going to have the same benefits from these growth hormone releasing peptides. But then once you're done with that cycle, that's where we bring in Sermorelin. And then Sermorelin is working on a little different pathway. Dr. William Seeds, thank you for your great work. If you ever happen to see this, he's just been a phenomenal leader in the peptide world. We just attended his symposium, his peptide symposium down in Vegas, and it's just a phenomenal experience there. But some of the things that I learned on these peptides, that there's about 100 different peptides that activate growth hormone in your body. So our bodies love growth hormone. IGF-1, LR3, this is one of the most powerful and my favorite. Tesamorelin and IGF-1 are my favorite peptides for growth hormone. But the thing that we learned is that you'll have less inflammation in your body, you'll get more deep sleep, your body will be able to recover from injuries much quicker. And for those of you who are receiving any kind of regenerative medicine, whether it's exosomes or stem cells, or maybe you're using cord plasma to detoxify your body, you'll find that those treatments are actually amplified when you activate growth hormone. And so it's not just Tesamorelin or Sermorelin, but you can also use IGF-1, LR3, you can use CJC1295, you can use Hexarelin, you can use Ipamorelin. I mean, there's so many of these growth hormone releasing peptides, but you want to make sure that you're cycling them at different times and different phases. The reason where we would use Tesamorelin over Sermorelin is if we run your blood labs and we see that maybe you have gallbladder issues, liver issues, you need more help detoxifying, so that's where your liver becomes really important. Or maybe you have developed that belly, also called beer belly or dad bod, or there's probably a lot of other names when you have the belly, but it's the thing that we don't want. And I know dudes, we do great, we can look in the mirror and we kind of suck in, but it's not just the vanity side of it, of having the belly that, you may not like the way it looks. The real issue is the inflammation that comes from having that visceral fat. So visceral fat is where you get fat around your organs, and your organs get more inflammatory. And when they're secreting more of these inflammatory messengers, then your body doesn't recover well, and your body starts to have this acceleration of aging. And you notice your skin doesn't look as good, you don't detoxify as well, and then you notice your cholesterol goes higher, your triglycerides go higher, your blood pressure goes up, you have insulin resistance, and next thing you know, you're on 5 different medications, and you're like, what happened to my health? 5 years ago, I was fit, I was healthy, started to develop a little bit of a gut. Now my doctor's got me on all these medications. I'm worried about having a heart attack. That's what we're trying to prevent. And so that's where we'd start with Tesamorelin. It seems to have the biggest punch. The other time that we'd use Tesamorelin over Sermorelin or other growth hormone peptides would be if you're like a bodybuilder and you're going up on stage and you want to get that little bit of extra definition in your abs. And there's other things that we'd use with that, like the Sloop 332. We'd probably have you on a microdose of like a GLP-1, just so you can get the body composition that you want. The time where we depart from that is maybe you have pretty good body composition overall, you don't have the belly fat, and your liver enzymes look great, you don't drink alcohol, you take care of yourself. Well, that's where we'd use Sermorelin, because Sermorelin, we'd see, okay, you've got an opportunity to increase your IGF-1 or your growth hormone. And Sermorelin is a very nice way of getting you there, of just helping you sleep deeper and recover better and keeping that growth hormone level optimized so that you can, stay young and no matter how old you get. But that's where Sermorelin would come in, when things look relatively healthy in your body. Now, that's just something we've observed over time. We've had over 70,000 clients come through our operation at East West Health. And if you're interested and you say, which one is right for me, you can simply go to agelessfuture.com and set up your health span assessment, and then we'll get the right testing for you if you haven't received it already. And we'll go deeper and we'll figure out which one of these makes the most sense for you. And there are some nuances in using these growth hormones, and you do want to work with a professional and get these from licensed pharmacies. But I've got a great video where I'll show you the details of how you can use Tesamorelin and Sermorelin together, when you would use them or wouldn't use them. I provided a link in the show notes. I appreciate you for watching these videos and working on your health. I'll see you in the next video.